The neonatal transport team at Overland Park Regional Medical Center, a part of HCA Midwest Health, provides swift intervention for critically ill newborns. Welcome to this edition of House Call. I'm Jessica Salazar, the Director of Marketing and Public Relations with Overland Park Regional Medical Center, a part of HCA Midwest Health. We have a dedicated neonatal and maternal transport teams here at HCA Midwest Health that are here to provide a higher level of care to moms and babies who are critically ill and need specialized care. Today, we are talking with Amy Gould, the NICU Transport Supervisor at Overland Park Regional Medical Center. Welcome, Amy.
Hi.
We're glad to have you here today.
I'm glad to be here. I'm glad to talk about our team.
Great. So you and I earlier were out. I was able to watch the NICU transport team take part in some education with our brand new helicopter. Can you tell me about our new transport helicopter that's available for neonatal patients?
Yes, so we have a new helicopter that we use to take on transport, and we use our same sleds with the transport isolette, and it goes in the helicopter. It's basically everything you need in the NICU just on wheels. So we can load it in the helicopter. We have bags with all the same equipment that we have in the unit. So basically we're taking the whole NICU with us.
What does it mean now that we have a helicopter? It's an exciting time for the NICU program at HCA Midwest Health.
Yeah, so it's awesome that we have a helicopter. What it means is we can get to our patients faster. So those really critical patients, we can get there and help as soon as possible. And sometimes, you know, there's traffic or it takes an hour and 2 hours to get there. Now we can get there in 30 to 45 minutes to some of those places, which is, you know, every minute counts. Mm-hmm. So it's exciting to be able to have the ability to do that, to help them.
Who's on the airplane? Who is a part of our NICU transport team?
Yes, so we always take 2 of our members. Now that may be an NNP or an RN, an NNP or an RT or an RN-RT combination. And then we have 2 from our vendor that come with us who are amazingly trained. It's a pilot, and they usually have a medic who comes with us who is trained as a safety officer for that helicopter, and or a nurse, a flight nurse that comes with us. So it's usually a 4-person team that you will see when we come. And they go through all sorts of amazing safety training.
What can a parent expect during a helicopter transfer? Can a parent ride along? What can they expect to happen to their child?
So there are certain weight restrictions with our helicopter. So with the isolette and the baby on board and our crew, there is not any more weight allowance to allow parents to come with us. We always introduce ourselves when we meet them. We give them a brochure that talks about our team and what we can do while we're on transport. We give that all to them, and then we call them once we have gotten safely to wherever we're taking the baby.
Now, this isn't our only mode of transportation. We also have a NICU ambulance. So how do you decide which mode of transportation to use?
So there's lots of rules and regulations based for how we take the babies, whether it's ground or helicopter. But typically our helicopter transports, unless scheduled, are emergent transports. So super sick babies that are probably farther than 30 minutes away, unless they're really, really sick and we can get there faster. So it's whatever we can do to get to the baby and get at what it needs when it needs it.
What special precautions are we taking as we transport babies during the COVID-19 pandemic?
So we've always been really, really careful on transport because a lot of times we're in environments where we may not always know what has been there before us. So we've always been really good about that. But some extra things that we're doing right now is you will see that all of our team is always wearing just a level 1 mask. So we will always have that on, and goggles. So we'll have that on. And then if there's any extra risks, then we take the full precautions that we have a whole plan through what we found from the CDC to help protect our babies, our patients, and our team.
What kinds of conditions would require a newborn to be transferred to a NICU that offers a higher level of care?
So it depends on where they're coming from, but most of the time, if they need to come to a higher level of care, they're typically on high levels of oxygen, or they might need resources such as our cooling program that we use on babies who have a hypoxic event at birth. Not all hospitals are able to do that kind of care, so we would need to transport them for that. Other reasons might be they're just extremely premature, and that hospital may not be able to handle that little of a baby. So we'll transport them to where they need to go to help care for them, get the care they need.
Yeah. What happens once a baby is transported here?
So once a baby is transported to Overland Park, we will bring them into our NICU. The same team that you met at the referral hospital brings them into our NICU. We will then put them in a crib, radiant warmer, whatever they're here for. They'll be nice, warm, taken care of. We'll put them in that room. They'll meet their new team, which is usually a practitioner, a doctor, and a nurse, and an RT. They're at the bedside, and any other consultation that needs to be met first. They will all meet the baby and start the admission to the NICU. Our team gives a full report. Also, usually we ask the referral facilities to call and update the if they're coming to OPR or wherever their destination is, just to make sure that a full report is given on that baby.
Not all babies that are transferred will come to Overland Park Regional Medical Center. We have a network of NICUs across Kansas City. Talk a little bit about that.
We also take babies to other HCA hospitals, such as Centerpoint, if it's closer for family, or Menorah, Research, any of those places. And then we can also work with St. Luke's. We have a working relationship with them where we transfer babies within their facilities as well.
Camera system. I know as of right now, only parents are allowed to visit the NICU, so parents of the patient in the NICU. How is the NICView camera system keeping families connected who can't actually come to the NICU?
Yes, so the NICU cameras are awesome. Each baby has their own camera that is on them 24/7. We don't always have it on. If we're doing patient care, then we won't have it on, but once we're done and baby's all tucked in and ready, you can access it through a secure network at any time and check on your baby and see your baby snoozing or looking around or any of the things that they like to do while they're in there. And then parents are allowed to give that information to grandparents or anyone else that they feel comfortable giving it to. But it's very secure and it's different from each baby. So you can't get on and look at other babies during the process, but you can see them, which is just nice to know what they're doing and snuggled in.
I think it's great too that it could be shared with additional family members. I was up there chatting with a family, and the mom could see, that there was 20 people, checking in on her baby. So it's just a great way to keep families connected during this time, especially during this time.
We also on transport, sometimes if the baby is and mom has a lot of questions about the care that they're going to receive at wherever they're going, we have the ability, especially if they're coming to OPR, that they can use our iPads that we take, and they can actually see the doctor that's going to be admitting their baby, and they can actually ask the questions that they're asking and see some of those teams, because it's not always that mom gets to come along right away with baby. So I know that that's sometimes comforting to parents to be able to have their questions asked and answered if the baby is stable enough to allow us to do that.
Thank you, Amy. You can learn more about our NICU, Johnson County's most advanced NICU, at oprmc.com/NICU.